Hello everyone, welcome to Shelley's Education Center. Today in our psychology class, I will discuss an important topic of clinical psychology. This will be very much helpful for the students appearing BSc BCS, BSc and preparing for UGC and other competitive exams. Today, if you are new to the channel, please subscribe the channel for more updates and be with me till the end of the class. Clinical psychology is an integration of social science, theory and clinical knowledge for the purpose of understanding, preventing and relieving psychologically based distress or dysfunction and to promote subjective well-being and personal development. The psychologist can identify any current or possible conditions through findings, interviews, and examinations. Instead, they devise a recovery plan together with the client as per the needs of the client. According to research, every third person in India is partly or completely left at the mercy of some of the other mental illness, which can be anxiety, eating disorder, depression, drug abuse, or learning disabilities. A clinical psychologist helps in caring these people. Career in clinical psychology are a wide psychological field concentrating on the care and treatment of mental, emotional, and behavioral conditions. Now, what is clinical psychology? Clinical psychology is a type of psychology. It is an integration of science, theory, and clinical knowledge for the purpose of understanding, preventing, and relieving psychologically based distress or dysfunction and to promote subjective well-being and personal development. It is the psychological specialty that provides continuing and comprehensive mental and behavioral health care for individuals and families, consultation to agencies and communities, training, education and supervision, and research-based practice. Clinical psychology is the branch of psychology concerned with the assessment and treatment of mental illness, abnormal behavior, and psychiatric problems. This field integrates the science of psychology with the treatment of complex human problems, making it an exciting career choice for people who are looking to work in a challenging and rewarding field. Austrian psychologist Sigmund Freud was one of the first to focus on the idea that mental illness could be treated by talking with the patient. He developed his talk therapy, which was the earliest scientific use of clinical psychology. American psychologist Lightner Whitmer opened the first psychological clinic in 1896. He first introduced the term clinical psychology in a paper. The time was 1907. Whitmer was a former student of Wilhelm Wundt. According to Whitmer, clinical psychology is the study of individuals by observation or experimentation with the intention of promoting changes. There was 26 other clinics devoted to the practice of clinical psychology had been established in USA within 1914. Nowadays, clinical psychology is one of the most popular subfields and the single largest employment area within psychology. Now the point is evolution. Evolution of clinical psychology. During the period of World War I, clinical psychology became more popular and established for its usefulness. American Association of Clinical Psychology was established in 1917. It was replaced by 2 years later with the establishment of APA, that is APA, American Psychological Association. During World War II, clinical psychologists were familiar as shell shock, now referred to as PSTD, which is post-traumatic stress disorder. By 1950, more than half of all the PhD level degrees in psychology were awarded in the area of clinical psychology. Now, what is the roles? What is the roles of the clinical psychologists? Number 1, assessments and diagnosis of psychological disorder in a medical setting. Treatment of psychological disorders including drug and alcohol addiction. Offering testimony in legal settings. Teaching at the university level. Conducting research and creating and administering programs to treat and prevent social problems. Now I will discuss about the difference between clinical psychology and counseling psychology. There are a lot of differences, such as number 1, the clinical branch focuses on psychopathology, the study of mental disorders. On the flip side, counseling psychologists help patients address social, emotional, and physical stressors in their lives. Number 2, a counseling psychologist has a stronger focus on healthy individuals who have fewer pathological mental problems. But a clinical psychologist has stronger focus on those with a psychosis or other serious mental illness. Number 3, within clinical psychology, students focus mostly on psychoanalytic persuasion and behavioral issues, whereas the counseling psychologist will favor humanistic and client-centered traditions. Clinical students preferred psychodynamic research, whereas the counseling students weighed towards cognitive behavior. Number 4, a counseling psychologist is more employed within a university, delivering counseling services. On the other hand, a clinical psychologist more often works in hospitals. Number 5, there are notable differences in the research areas of the two disciplines. Clinical psychologists favor psychopathological conditions, whereas counseling psychologists prefer vocational assessment and cross-cultural psychology. Therefore, the difference is in the frequency with which the two disciplines participate in these programs. Number 6, counseling psychologists seem to be more interested in the humanistic approach, dealing directly with behavioral problems that can be resolved in the community. But clinical psychologists prefer more serious mental illness where hospitalization is generally required. Now, what is the relations between clinical and counseling psychology? On this point, I will discuss the relation. Clinical psychology is the study that is in charge of treating the human's mental health and its unusual behavior. Counseling psychology is the study that is in charge of the causes of human disorders or their symptoms. A clinical psychologist do counseling all the time, but a counseling psychologist cannot enter into the area of clinical psychology, as he has no authority to prescribe medicines. Now, coming to the conclusion of clinical psychology. These science-based approaches developed and refined within clinical psychology provide an opportunity to prevent, identify, and treat mental health conditions, providing multiple levels of education and training in the practice of clinical psychology extends the reach and benefits of science-based services, increasing equitable access to mental health care. There is also an opportunity to redefine the doctorate in the light of master's degree and to standardize the full spectrum of education and training in clinical psychology across the world. Here it is all for the day. Believe you all were there till the end of the class and have gone through it well. Inbox me if you have any query. Please do share and refer it to your friends and known circles, those have not yet joined with the channel. Meet you all on my next class. Till then, thank you.